He told me he hadn't cried since he was 9 years old. Said it like it was something to be proud of. And then I uncapped the syringe and his whole face just crumpled. Just for a second, like a paper lantern in the rain. I didn't say anything. I just kept moving. Slow, deliberate. The way you move around something you don't want to startle. It was a Wednesday evening, the kind that feels like it can't decide if it's still day or already night. That in-between light that makes everything look a little softer than it actually is. I was doing a home visit for a family friend. Well, a friend of a friend, which in my experience is how you end up in the strangest rooms, holding the strangest conversations. His name was Daniel, 30-something, broad shoulders, the kind of quiet confidence that fills a room without announcing itself. He'd pulled something in his lower back, a muscle spasm that had been getting progressively worse over 3 days. His doctor had prescribed an intramuscular anti-inflammatory injection. His doctor, who was, at that moment, on vacation somewhere, with a beach and no cell service. His regular nurse had called in sick, and somehow, through a chain of phone calls that I still don't fully understand, I ended up at his door with my kit bag over one shoulder and a container of takeout soup that his neighbor had pressed into my other hand with the urgency of someone passing a baton. He answered the door in a gray t-shirt and the expression of a man who had spent 3 days pretending he was fine. "You're the nurse?" he said. "I am," I said. He looked at the soup. He looked at me. He said, "I thought you'd be older." I said, "I thought you'd be less surprised to see me." He laughed, short, a little reluctant, and stepped aside to let me in. The apartment was clean. That detail always tells you something. When someone's in pain and their space is still organized, it means they're the kind of person who controls what they can control. There was a half-finished glass of water on the coffee table and the book left face down, which told me he'd been lying on the couch trying to read and failing. A heating pad was plugged in near the armrest, slightly warm when I passed my hand over it. "How long has it been since you've been able to stand fully upright?" I asked, setting my bag down. "Since Monday morning," he said, lowering himself carefully onto the edge of the couch. Even that small movement, you could see it cost him something. The way his jaw set, just slightly. "And you've been taking the ibuprofen your doctor recommended?" "Every 8 hours, with food." "Good," I said, and I meant it. That matters more than people think. Taking NSAIDs on an empty stomach is its own little disaster waiting to happen. Nausea, stomach lining irritation, sometimes worse. Always with food. Always. I washed my hands at his kitchen sink, dried them, and pulled on my gloves. That sound, the snap of nitrile. I've noticed it does something to people. It makes it real. His shoulders went up about half an inch. "Have you had an intramuscular injection before?" I asked, coming back to him. "When I was a kid," he said. "I don't remember it fondly." "Most people don't," I said. "But you were also a kid. Things feel different when you're small and someone's very tall and holding something sharp." He looked at me. "You're not that tall." "No," I agreed, "which works in your favor." I explained what we were going to do. I always explain. Not because I'm required to, because it helps. When people know what's coming, their nervous system has something to hold on to. The unknown is almost always scarier than the actual thing. The injection was going into the gluteal muscle, the upper outer quadrant specifically. I know that sounds very clinical, but there's a reason for that exact location, and I told him so. That part of the muscle is dense enough to absorb the medication properly, and far enough from the sciatic nerve that we're not going anywhere near it. That nerve is the one that, if irritated, sends pain shooting all the way down the leg. We give it a very wide berth. I asked him to lie on his side, facing the back of the couch. There was a pause. "You're sure this is necessary?" he said. Not quite a question. "The oral anti-inflammatories aren't cutting it," I said. 3 days in, you're still at a 7 out of 10 on pain. The injection works faster, gets into the bloodstream more directly, and the muscle relaxation effect is... Honestly, you'll feel it within the hour. Another pause. Then he shifted, slowly, onto his side. I located the injection site by feel, the upper-outer quadrant, mentally dividing the muscle into 4 sections and choosing the outermost upper one. I cleaned the area in a circular motion with an alcohol swab, starting at the center and moving outward. Let it dry for a few seconds. This part people always rush, and you shouldn't. Wet alcohol on the skin when you inject stings more and can affect the medication. "Take a breath in," I said quietly. He did. "And let it go slowly." He did that too. And as he exhaled, his muscle, I felt it under my fingers through the glove, released. Just slightly, just enough. I inserted the needle at a 90-degree angle. Smooth, confident, no hesitation. Hesitation is what makes it hurt. A slow, uncertain entry drags. A clean, decisive one is over before the nervous system has time to register alarm. I aspirated slightly, a quick check to confirm we weren't in a blood vessel. Clear. Good. Then I pressed the plunger slowly, steadily, over about 10 seconds. Not fast, never fast with an intramuscular injection. The medication needs time to disperse into the tissue, and pushing it too quickly causes that deep, aching pressure that people remember for years. He didn't make a sound. I withdrew the needle in one clean motion and pressed a small piece of gauze to the site, held it there for a moment. "Done," I said. He was quiet for a second, then, "That's it?" "That's it." "Huh." He sounded almost disappointed, like he'd been bracing for something that never arrived. I pressed gently on the site, not rubbing, just light pressure, to help the medication begin to distribute. Rubbing can sometimes cause irritation or bruising, depending on the medication. Gentle pressure is enough. I stayed for a few minutes after, not because I had to, but because I wanted to make sure he didn't have any immediate reaction. Most people don't. But the first few minutes after an IM injection are worth watching, especially if it's someone's first time with that particular medication. He'd pulled himself to sitting, slowly, and was looking at the soup container his neighbor had sent. "Chicken noodle," I told him. She seemed very sure about it. "Mrs. Okafor thinks soup fixes everything," he said. "She might not be entirely wrong," I said. He looked at me with that look, the one people get when they're not sure if they're allowed to be charmed by someone who just stuck a needle in them. I started packing up my kit. "One more thing," I said. "For the next couple of days, heat, not ice. For muscle spasms, heat increases blood flow and helps the tissue relax. Ice is for acute injuries, the first 24 to 48 hours. You're past that window. So the heating pad is actually the right call, just not more than 20 minutes at a time and always with a layer between it and your skin." He nodded. 20 minutes. Layer. "And if the pain hasn't improved by tomorrow evening, or if it gets worse, you call your doctor, not me." I smiled. "I'm a one-time solution." He smiled back, a real one this time, slower than the first. "That's a shame," he said quietly. I snapped my kit closed, pulled off my gloves, let that sit in the air for exactly as long as it deserved to sit. Then I picked up my bag, said goodnight to the soup, and let myself out. Some people you meet for 20 minutes and they stay with you for years. Not because anything happened, just because of the quality of the quiet between you. The way someone breathes when they finally let themselves trust you. That's the thing nobody tells you about this work. The needle is the smallest part of it.